Good afternoon and welcome to Madison VA Hospital's live teletown hall. Our leadership team is excited to hold this teletown hall with women veterans who use the Madison VA or any of our 6 community-based outpatient clinics in Baraboo, Beaver Dam, Janesville, and Madison, Wisconsin, as well as Freeport and Rockford, Illinois. I encourage you to stay on the line with us and participate. This gives you an opportunity to speak live with us and ask questions about your VA health care. This format allows us to reach more veterans so we can ensure we hear your voice and focus on what's important to you. My name is Tammy Town. I am the Madison Women Veteran Program Manager, and I'll be moderating this afternoon's call. Thank you for taking the time to join us. A panel of Madison VA's leadership team is here to provide information and answer your questions. We also have staff from mental health, full health, community care, primary care, and several other areas to assist in answering your questions. Please note, for the next hour, we will provide information on the VA Medical Foster Homes, the Veteran-Directed Care Program, East and Baraboo Clinic opening updates, PACT Act, LGBTQ+ updates, suicide awareness, peer support, and My Life, My Story program. In between updates, we'll have a live question and answer session. If you would like to ask a question, just press 0 on your phone and you will be connected with a staff screener who will take your question and get you into queue to speak with our panel. Again, that's 0. We'd like to address as many of your questions as possible during this call, so we have to limit participants to only 1 question each. If you do get on air, please remember that other veterans are in line to ask questions, so keep your questions brief and please do not share your personal health information in this public forum. If we are not able to answer your question on air, we will make sure to follow up with an answer to your specific concern. We want to make sure that all questions received are answered. If we don't make it to your question by the end of the call, be sure to stay on the line and you'll have the opportunity to leave us a voicemail so someone can get back to you. Now I'll turn over our call to our Facility Executive Director, Ms. Christine Kleckner, for opening comments.
Thank you, Tammy. We are thrilled that you are joining us this evening to participate in our teletown hall. I am happy to be here with all of you, and I'm looking forward to hearing from you. We know that women veterans are the fastest growing population in VA care, and we want to provide you with the best possible care at the Madison VA hospitals and clinics. We want to provide you with the information so you can utilize all the services that are available to you and so you can share these resources with your fellow veterans. This teletown hall is a great way to get this information to you and also receive feedback from you. Today, we have exciting updates on our clinics that will be opening soon, as well as several new and ongoing programs. On behalf of our executive leadership team, I thank you for your participation, and I look forward to hearing your questions and learning how we can better serve you.
Thank you, Director. Our first update is on medical foster homes that we are now providing at Madison VA. Aging veterans are finding a new place to call home through the Medical Foster Home Program. Last year, the Madison VA became a program site that provides veterans with an option to move into a residential home that has a live-in caregiver versus going to a nursing home. These residential homes have a maximum of 3 residents and are very family-like with individualized care. The expectation is of a long-term arrangement where the veteran may live for the remainder of his or her life. Another benefit of the Medical Foster Home Program is the veteran's primary care team comes to the home versus the veteran having to come to a clinic. Caregivers are paid each month from the veteran's funds to provide the required care. Monthly rate and care include a room, personal care, 3 meals a day, medication management, activities, and 24-hour supervision. In almost all cases, medical foster homes are a lower-cost alternative to nursing home placement. We recently placed our first veteran into a medical foster home, and he has seen a huge improvement in his health, well-being, and family relationships. If you are interested in residing in a foster home or providing a home, please call Jordan Miller, our Medical Foster Home Program Coordinator, at 608-830-6650. Again, that is Jordan Miller at 608-830-6650. Our next update is on another new program. Did you know that veterans now have the option to pick their preferred caregiver and hire them to help with activities of daily living? There is a new program at our VA called Veteran Directed Care, or VDC, and this program gives veterans the opportunity to receive help with daily living activities such as bathing, dressing, or fixing meals. If eligible, veterans receive a budget to hire their own employee or caregivers to meet these needs. You can control the services and support you want, who you hire, including family members and friends, your personal living arrangements, and your goals. Services are based on veterans' assessed needs, and all veterans are required to be assessed for eligibility. Currently, the Veteran Directed Care Program targets veterans with 3 or more activities of daily living, or ADLs, dependencies, such as needing assistance with bathing, grooming, transferring, toileting, and other things, who have a desire to remain at home instead of nursing home placement, can manage their program, and have identified an employee or caregiver. If a veteran is unable to independently manage their program, they have the option to appoint the authorized representative. To learn more about the Veteran Directed Care Program, please reach out to your primary care social worker. Next, we have an update on our Baraboo and East clinics. The new Baraboo VA clinic is very close to completion, and we are excited to announce that we will be opening the clinic for care beginning in July. The new clinic is located less than a mile from its current location at 414 State Highway 136 in Baraboo. It is next to Anytime Fitness and across from the BP gas station. This 10,000 square foot clinic will be staffed by about 30 VA employees. We have already added another patient-allied care team, or PACT, an additional telehealth room for expanded telehealth services, and a dedicated lactation room for veterans and staff. There will also be a large dedicated space for physical and occupational therapy, nutrition, and whole health. We plan to start seeing the veterans at our new Baraboo clinic in July. Future announcements will come out about an open house after the Baraboo clinic opens. We look forward to seeing you at the new location in July. We are also excited that our brand new Madison East VA clinic will be opening this summer. This clinic is located at 4904 East Park Boulevard in the American Center Development near the intersection of Interstate 9094 and Highway 151. The East VA clinic will offer access to services that some of you, especially those receiving care at Beaver Dam, may find more convenient than coming to the main hospital campus. The clinic will provide primary care, including a dedicated women's health PACT, physical and occupational therapies, nutrition services, including a healthy teaching kitchen, mental health, telehealth, blood draw, radiology, x-ray, and whole health services. The new East Clinic will be staffed with several providers that are currently located at the West Clinic. Our plan is for veterans to follow providers to their assigned locations. The first round of letters alerting patients of their provider's location was sent in early March, and we just completed sending the second round. These letters remind veterans of their provider's location and how to request a change. We are planning to open the East Clinic this summer as well. The East Clinic webpage is now live and includes answers to some frequently asked questions. Just search online for the Madison East VA Clinic for more information. Another update we would like to provide you is on the PACT Act from Judy, our Health Benefits Services Supervisor.
If you haven't heard, beginning March 5th, 2024, veterans exposed to toxins and other hazards while serving our country are eligible to enroll directly in VA health care without first applying for VA benefits as part of the PACT Act. Veterans who believe they were exposed to burn pits, Agent Orange, chemical, nuclear weapons, and other toxins while serving may be eligible. It also includes veterans who never deployed but were exposed to toxins or hazards while training on active duty here at home by working with chemical, pesticides, lead, asbestos, certain paints, nuclear weapons, x-rays, and more. Many veterans hesitate to reach out to VA if they don't have immediate health concerns, but it's important for them to get established now before they need the care. We are proud of our staff who are dedicated to meeting veterans' health care needs and who have earned a 94% trust scores from those we serve in our catchment area. There are many veterans who don't receive their care at VA, opting for other options. We encourage you to share the care and suggesting those veterans reach out to VA for health care needs and to get established earlier rather than later so that we can provide the best care possible. To all the veterans out there, don't wait. Apply for the care you deserve at va.gov/PACT and choose VA as your trusted provider. Please encourage your fellow veterans to do the same. Again, that's va.gov/PAC.
Thank you. Our next update before taking some calls is from Margot Edge, our LGBTQ+ coordinator.
Hello, my name is Margot Edge, and I'm the Madison VA Hospital and Clinic's LGBTQ+ Veterans Care Coordinator. Before we know it, it will be summertime, and we would like to wish everyone an early Happy Pride Month. There have been some updates on national policies and rulemaking in recent months that we want to share with you. First, VA Secretary McDonough announced in a press conference in March that the petition for rulemaking related to adding gender-affirming surgery to the medical benefits package is in active litigation. At this time, the VA has been asked to produce estimates and provide data on veterans who have become newly eligible for health care under major recent expansions of care through the PACT Act, Service Act, and Compact Act. While undertaking additional consideration and analysis of gender-affirming surgery, VA will continue to provide other types of gender-affirming care to veterans, including hormone therapy, voice and communication training, gender-affirming prosthetics, mental health services, and more. Secondly, VA recently announced that in vitro fertilization services will be expanded to include eligible unmarried veterans and eligible veterans in same-sex marriages. The new expansion will allow for the use of donated sperm or eggs for those unable to produce their own sperm or eggs or due to service-connected injuries and health conditions. This policy is currently being implemented across the VA system and is expected to be ready to provide these expanded services in coming weeks. This policy change is a big step forward for providing equitable, inclusive, and respectful health care for all veterans. If you have any questions or concerns about LGBTQ+ veterans health care, you can reach me by calling 608-256-1901, extension 10762. Again, my name is Margot, the LGBTQ+ Veterans Care Coordinator, and my extension is 10762.
Thank you, Margot. Next, we want to take this opportunity to learn from all of you. We have a couple voting questions before we open up the call for all your questions. The first question is, do you prefer women veteran-only teletown halls like this one, or do you prefer mixed teletown halls with all veterans? For women-only teletown halls, press 1. For mixed teletown halls, press 2. Again, the question is, do you prefer women veteran-only teletown halls like this one, or do you prefer mixed teletown halls with all veterans? For women-only teletown halls, press 1. For mixed teletown halls, press 2. All right, so just looking at all the input coming in, thank you for your input. It's looking like we have a little bit of higher preference, about 70% with women-only teletown halls and about 29% mixed teletown halls. Thank you for your input. One other question related to the teletown halls. So in the past, you may have received phone calls inviting you to both our Women Veteran Teletown Hall and our All Veteran Teletown Halls. As we did today, we begin our Women Veteran Teletown Halls at 5 p.m. and our All Veteran Teletown Halls at noon. Do you personally prefer to have these calls at noon or at 5 p.m.? For noon, press 1. For 5 p.m., press 2. Again, the question is, in the past, you may have received phone calls inviting you to both our Women Veteran Teletown Hall and our All Veteran Teletown Halls. As we did today, we begin our Women Veteran Teletown Halls at 5 p.m. and our All Veteran Teletown Halls at noon. Do you personally prefer to have these calls at noon or 5 p.m.? For noon, press 1. For 5 p.m., press 2. All right. So looking at the numbers, it looks like you do prefer this 5 p.m. time. Excellent. About 87% and then 13% prefer the noon time. Thank you for your responses. We'll use this feedback for our teletown hall calls in the future. We have a few more updates on suicide prevention, peer support programs, and My Life, My Story. However, let's take a few questions. And remember, to ask a question, you just need to press 0 to speak to one of our operators. Hi. Hi, Deb. Are you there?
Hello.
Hi. What question do you have, Deb?
I was in during the 80s, and I was one of the
people in charge of the nuclear, biological, chemical warfare pits, where I was in the chamber a lot doing training with gas mask items. I now have a ILD, essential lung disease, and they've done biopsies but can't determine what caused it. Is it worth me submitting this toxic exposure thing? Or, because I'm already considered unemployable, or should I go ahead and still submit this?
Hey, it's Dr. Marsh, Chief of Staff, and I'm really sorry that this has happened to you. And are you getting your care in the VA system then right now?
Yes, I'm 100% at the VA. I mean, I only have half of one lung and a quarter of the other lung left, and I've refused lung transplant because it's hard enough living on as many medications as I'm already on. So I don't know if it's worth continuing on or what I should do.
So the answer to your question is I always encourage people, even if they're 100% to go, if they feel like they have a claim for a condition, to go ahead and make that claim because there might be other benefits that you're eligible for that you're currently not. And then there also could be a survivorship benefits, et cetera. So things to consider when you're looking at that. As far as, whether it's related to the exposures, as part of the PACT Act, we started screening all veterans. I'm not sure if that's happened to you yet, but we do have some toxic exposure specialists here at the VA, and they can also get you in touch with some of our environmental health providers who might be able to point you in the right direction on that, as well as it sounds like you're involved with the lung doctors here who could also answer some of those questions. So those would be some avenues to pursue with that.
Yeah, I've never been involved with anybody until I went in for pre-op, and they gave me this toxic exposure screening information paper, and I didn't know really what to do with it.
Yeah, so you can, if there's, your primary care provider should be able to put you in touch with those toxic exposure specialists, and they can help kind of, again, navigate some of these questions that you have.
Okay. All right.
Thank you, Deb. Sorry, we clicked a little too quickly. Next up, we do have Sylvia from Madison. Sylvia, are you there to ask your question?
Yes.
So what question do you have for us today?
I would like to know, why do they not have dental and vision as a part of our veterans coverage? I mean, our teeth, isn't that important to our health as well? But we have to go outside the Veterans Administration to get dental and vision, purchase extra Medicare packages. Why can't we get dental and vision with the veterans? I mean, I know we got dentists and optometrists in the military. I've been there. I was a medic. Why can't we get that coverage with our veterans care?
Hi, Sylvia. This is Kristen. I'm with our primary care team. It's a really good question. For vision, we do offer vision benefits if you are currently already enrolled in VA healthcare. So what I encourage you to do is to talk with your primary care provider and ask them to set up an exam for you. For dental, certain veterans are eligible. If you're unsure about your eligibility, what I do recommend is that you call our eligibility office, and you can do that directly through our main number, 608-256-1901. Again, 608-256-1901, and you would want extension 17038. Or you could also talk to your primary care team to determine, if they feel like you're eligible, and then they would refer you on the path that you would need to be referred. I hope that helps.
Oh, it did, because I don't have no teeth and I'm going blind. So I need some type of help really bad. So thank you very much. I will contact the eligibility people and see what I can do.
That was perfect. Thank you. So next up, we have Lisa from Sun Prairie. Lisa, are you available for us to talk to you?
Hi, I'm Lisa, and I just wanted to make people aware that if they're the women that are changing their last name, do so right away, so that their records so stuff doesn't get mixed up. That's all I wanted to say. I just want to remind people.
That's a great reminder, Lisa. Thank you. Yes, it's important to change your name. So if you have a name change, please let us know as soon as you can so we can make sure we keep your medical records up to date. All right, let's take another veteran. So we have June from Baraboo. June, what can we do for you today?
Well, I would like to know why I cannot get a procedure done at the VA urology instead of being referred to an outside hospital. It's a procedure that's done by a nurse, and I got a bill from this hospital for over $1,000, and they have sent it to a collection agency.
Hi, June. This is Carl, Community Care Supervisor.
Hi.
June, what I'd like you to do is call our community care line. This is a public forum, and there's some stuff that we should discuss that is of a private nature. So what I want you to do, June, is tomorrow at 9 a.m. when our line opens up, I want you to call this phone number. Do you have a pen handy to write this number down?
Yes, I do. Yes, I do.
Okay. Phone number is 608-830-6431.
6431. Got it.
And that's going to connect you to one of our MSAs in community care. And then what I want you to do is I want you to ask for Carl. Okay?
Carl. Okay.
And my name is C-A-R-L, Carl.
Got
and I'll help you through that process, June, okay?
Thank you, Carl.
You're very welcome.
Thank you, June. We'll take another caller. So we have Linda. Linda, are you able to take our call?
Yes,
talk to
Linda.
us? Oh, perfect. So
Hi.
what question do you have for us?
So kind of a twofold, but it's the kind of the same question. So I'm a Gulf War vet and having the symptoms are getting much worse since 2015, and that's when I started coming to the VA around that time. But the issues that are getting worse, and I know it's all related to the Gulf War, I'm just not getting the care that I need. Now, I heard you earlier say that there are some, the toxic exposure doctors, but I'm not getting referred from my primary doctor to these. I have been going to her and asking and pushing for all these tests to be done. I'm also having these new symptoms that are getting me to the emergency room. I'm not getting any follow-up. I'll get testing done after I ask for them 4, 5, 6 times and finally get the tests done that I need, but then the results don't come back and they're not uploaded to My Healthy Vet for 2 months or longer, but then I'm not getting follow-up with my primary. Now, I've also heard that my primary is moving to the West Clinic farther away. I specifically stopped going to the West Clinic because the atmosphere was not what I was looking for as far as, the women's clinic. It was just, it feels like the women's clinic is being made for, you go to the women's clinic so you feel more comfortable there, but it's more about female doctors. I don't care about having a female or male doctor. I want a doctor that's knowledgeable in the Gulf War illness issues that we're having, and they're getting worse. And I'm having swallowing issues that are just, I keep going to the ER and I'm not getting help, and they keep saying go to your primary, and I've heard that you guys say that today, go with your primary doctor. Well, my primary doctor's been on personal leave for 3 months and now moving to the West Clinic. I don't want to go farther away, and I don't know where I'm ending up, but I'd rather travel to see someone that is familiar with the Gulf War.
Hi, Linda. This is Kristen from Primary Care. It sounds like there's quite a bit in there, and I'm sorry that you are experiencing the concerns. What I'd like for you to do, it doesn't sound like you really feel that comfortable or confident in your primary care provider's expertise with the Gulf War. So a couple of things that I would recommend is maybe reaching out to our patient advocate office. And you could call them directly at the main number again, 608-256-1901. Again, 608-256-1901, and you want extension 17182. Again, 17182. And, if you're unhappy with your current provider, you may want to just consider putting in a request for a different primary care provider.
Yeah, I've been trying that, and it hasn't been working. So I'm just looking, and when I do call, they don't tell me who. I've asked for that 4 years ago, someone who was specialty in this area, and it still hasn't happened. So, but I'll try again. It's been years of advocating for myself, and it's not working. But I'm just wondering if you have specific doctors here that are experts in the field. I don't, because all my questions funnel down to that one issue, that my primary care doctor is knowledgeable. Now, my current primary care doctor, she has done things that were wonderful, but the follow-up is not there at all. None. So it's been a year and a half of extreme emergency room visits. So I just didn't know if you all knew. Yes, we have so many doctors there. Are there specific doctors at our Madison VA that are expert in that area? Because maybe that would solve all the problems I'm having.
Understand, Linda, and if maybe we can get some information from you offline. We can work with you to assist with putting in the provider request and getting you on the path where you need to go.
All right. Thank you. Thank you for your questions thus far. We'll have another open session for more questions, but we want to finish on some of our updates. So next we have Jennifer John Cox, our Suicide Prevention Coordinator, with a Suicide Prevention update.
Hello. This is May, and it's Mental Health Awareness Month. We want to make sure our veterans have access to resources that support suicide prevention. The VA offers suicide prevention therapy through telehealth. In addition, Project Life Force is a newly developed group therapy to help veterans who struggle with suicidality by combining suicide safety planning with therapy skills and education. In PLS, veterans learn and practice skills essential to increasing suicide prevention, coping by enhancing social connection, and improving emotional regulation and discovering meaning and hope. Veterans always have access to the Veterans Crisis Line by calling 988 and pressing 1. In addition, we support increasing lethal means safety by giving away free cable gun locks. If you are interested in learning more about the therapy options or needing a cable gun lock, please reach out to your mental health treatment coordinator or primary care provider, as we often have the cable gun locks in the clinic.
Thank you, Jennifer. Next we have Rhea, our local recovery coordinator, with some updates on peer support.
Hello. It's that time again to spread the word about recovery and peer support services at the Madison VA. Many are aware of our wonderful Ann Buckwell, peer support specialist who works in Madison and Rockford. Ann is a Navy veteran who has been with peer support and women's health team for the last 3 years. She is trained to effectively use her lived experience to inspire hope and serve as a relatable role model for recovery for other women veterans experiencing mental health, substance abuse, and/or physical health needs, and assists in identifying needed resources as well as veterans' personal strengths and skills that support their treatment and personal goals. She is not a licensed clinician and does not provide clinical counseling or therapy, but she works alongside very closely with the providers that do offer significant therapeutic value through the work as they support veterans. If you or a veteran you know are interested in learning more about recovery-oriented care, peer support services, or how to start your own recovery journey, please feel free to reach out to me directly, the local recovery coordinator, at 608-332-1628. Again, that number is 608-332-1628. If you're looking to be more a part of a veteran community, groups, and or socials, please stop in at the Patient Education Resource Center, also known as the PERC, at the main hospital on Mondays, Wednesdays, and Fridays to learn more and or have a casual conversation with one of our peer specialists.
Thank you, Rhea. Our final update is on a program that started at our Madison VA 10 years ago that captures your veteran story to be included in your medical records so that providers can understand your experiences and better serve you. It is called My Life, My Story, which offers you the opportunity to be interviewed about your childhood, military experiences, and after military life. Interviews can be done over the phone or video conferencing or in person. To learn more about the program, you can go to the VA website at www.va.gov/whole health, that's all one word, / My Life, My Story, again all one word, / Again, that website is www.va.gov/whole health / My Life, My Story / Or you can call the My Life, My Story office at 608-256-1901, extension 11962. Again, that extension is 11962. Lastly, you may email them at mystory@va.gov. Again, that is mystory@va.gov. We would love to have more of your stories, so please reach out to share them. Let's go back to questions from all of you. So first up, we have Kathy from Rockford in Illinois. What question do we have from you, Kathy?
I had a question. I think that the information you have put out has a lot of uses. I might not use it today, but maybe later on. And with that being said, I did not have pen and paper to write down all the new programs and all the new contacts and all that information. Is there somewhere that all this information is going to be put in, like a meeting notes or minutes that we could have access so it would be readily available to us?
Hi, Kathy. This is Jim from Public Affairs. Thanks for reaching out. So good news and bad news. Good news is we upload all of our teletown halls online, so you can even go back and listen to past ones if you'd like. And it usually takes a week for that to be transcribed and for us to post it on our main website. But if you dial our main number 134, or with extension 13484, that's my extension, and I could also summarize it and send you all of the contact information.
Okay, so that extension was 13484, is that correct?
Correct.
Okay, and that was the main hospital number you're referring to?
Correct. 608-256-1901.
Thank you. I'll definitely be giving you a call because, like I said, there was a lot of useful information, and I might not need it today, but, 6 months down the road I might. So, yeah.
And we understand it's also hard because you're not seeing us and we can't present anything to you, so it is hard to kind of track all the resources and phone numbers, so we understand that. And then I think Ann had something to add.
Hi, Kathy. I'm Ann. I'm the Women's Health Peer Specialist. And I'm the Women's Health Peer Specialist here at the VA in Madison and in Rockford. And you are more than welcome to come to the clinic in Rockford on Tuesdays and Thursdays when I'm there, to either participate in socials that we have there and groups for peers there. We have a garden on Thursday, but you can also come up to the PERC on Monday, Wednesday, or Fridays, and I am always in the PERC on Wednesdays, and I will always have a cup of coffee for you.
Okay, and what was your name again?
My name is Ann Buchwald, and I'm one of the peers here in Madison and Rockford.
Okay, great. Great information. Thank you.
All right, thank you, Kathy. All right, so next up we have Yvette from Fond du Lac. Yvette, are you on the line?
I am.
Perfect. So what question do you have for us?
From what I understand, there may be a Fond du Lac clinic in the works, and I'm wondering, is there an estimate on when that may be built?
Hey, thanks, Yvette. This is Abe Rubinowitz. I'm the Associate Director. Fond du Lac is actually in the Milwaukee catchment area, so it's outside of our area of control for clinics. It's kind of in between their Appleton, Cleveland clinic and Beaver Dam. So we don't have any information on plans for them to pursue a Fond du Lac clinic, but we're not sure, but that may be in their plans. So we don't want to speak for them or their future plans. But I know you're kind of in between Appleton and Beaver Dam, and everybody always wants care a little bit closer to their home. So I'm sorry we don't have an update on that for you, and I'd encourage you, if you're interested in that, to perhaps connect with Milwaukee and ask if there's anything in their planning for a Fond du Lac clinic.
Oh, okay.
All right, thank you, Yvette. Next we have Laura from Fort Atkinson. Laura, what question do you have for us today?
Hi, I have two questions. The first one is, at the New East Clinic, are they going to have mammography? And the second is, are they going to have a dedicated female veteran-only entrance?
Hi, Laura. This is Kristen from Primary Care. The New East Clinic will offer general radiology, so no mammography. However, if you are in need of that service, definitely work with your primary care provider. And then for the dedicated women's health entrance, we don't have a specific entrance dedicated. However, when you check in, if you indicate to our MSA staff that you would like to wait in a different area other than the general waiting room area, we will most definitely accommodate that. We want you to be comfortable in the clinic.
All right, and then just as a reminder, too, for mammography, so we don't have mammography on site at our Madison VA, but you are eligible for mammography through community care. So we do offer that service through your primary care provider if they would place a referral, and that would be how you would receive mammography. All right, next up we have Anna from Rockford. Anna, do you have a question for us today?
Hi, how are you?
Good.
Good. My question is there ever going to be a women-centered, maybe like gynecology that comes to the clinics as opposed to just the hospitals? And also something that might be more specific, geared toward women. I know there's whole health. I know there's peer support, which Anne is fantastic at, and I remember Katie Beck was phenomenal doing all that. But something that would be not just having an OB-GYN or specifically gynecological, but female issues at the clinics.
Yeah, so currently we only have the gynecologist at the main facility in the Women's Health Clinic. We don't have any gynecologists in the CBOX. However, our Women's Health are designated to provide a lot of that gynecological care, so they can provide most of the care. If it's very specific, then we do refer the veterans back to our primary site at the Madison Hospital. That is something that we are thinking about, though, as we look at population size and needs of our veterans to see where we could place gynecologists, if that's an option in the future. We also do have our pelvic floor physical therapist, and so she's a fabulous resource, and she is available at our East Clinic and at the main hospital once the East Clinic opens. And so we hope that will help too, because she's able to help out a lot with gynecological issues as well.
Okay. Yeah, I'm 2 hours away from Madison, and I don't drive, so even getting to Rockford is very difficult for me. And there's no type of transportation or anything that is, provided or that I can get, so I have to find rides. So, and the only thing is that going to, OBGYN, I can go through community care, but it is also cumbersome and stuff. But if I do go through primary, they tell me I can only go every 5 years unless I'm having issues. That to me is a little bit, not enough. And then as soon as you say you're having, certain symptoms, right away it's anxiety. Or even if you're like menopausal, you need to go on antidepressants. That's not women-centered care. So I just was wondering if there's ever going to be someone that understands female hormones and just the female chronic illness and things like that specific.
Yes, no, very good questions. And we do have our gynecologists we do have options with our gynecologists for telehealth. So we are able to do some virtual visits if that's able. I know not all of that type of care can be done through them, but that is a misconception about gynecology care. You can only be seen every 5 years. That is something, if you have a need, that we can refer you to our internal gynecologist or even externally if that's needed. So I hope that if you do need assistance, you can reach out to me. And I can help you out with that as well. I do want to also say that our pelvic floor physical therapist also does telehealth as well. So she's a great resource, too, for some of those pelvic concerns as well as even some of that menopause, going through menopause and some conditions like that. She's very helpful with. Back to me, if you need some extra assistance or need the assistance with your provider, again, my name is Tammy Town. I'm the Women Veteran Program Manager, and I can be reached at the main hospital number at 608-256-1901, extension 10907. So again, that's 608-256-1901, extension 10907. All right, thank you for the questions. Very excellent. Next up, we have Doris from South Beloit. Doris, how can we help you today?
Yes, my name is Doris, and I'm calling. I was going to the VA in Rockford, and then I got on my husband's insurance, so I stopped going. I want to know what I have to re-sign up to go back to get a primary care.
Hi, Doris. My name is Liana Torres. I'm the Chief of the Patient Administration Services. We'll be happy to welcome you back at the VA hospital. What I would like you to do is to please call us at, are you ready to write down a number?
Yes, I am.
If you can please call us at 608-256-1901.
1901?
Yep, extension 17038.
17038. Okay.
17038, that is the extension for our eligibility department. They will make sure that your eligibility, your enrollment is the way it should be, and then you will be assigned to a primary care team, and they will put a consult for you so you can get scheduled.
Oh, well, thank you very much.
Yep, thank you for your question and for calling.
Thank you, Doris. All right. Next up, we have Marissa from Menominee Falls. Marissa, how can we help you today?
Hi, ma'am. I was wondering if the VA has any, information on eating disorders or something like that. I don't think I have one, and I'm not trying to get too into it, but I could care less about, eating your food, and I look up online, and that's, not qualifying as an eating disorder, but I feel like it's not normal, and so I didn't know if there's anywhere in the VA where you have more information about that, or who would be the person to talk to for more information on that kind of stuff.
Hey, Marissa, that is an excellent question. This is Sarah Fraser from Mental Health. And I really appreciate you asking it because I'm guessing there's other people that are also wondering the same thing. And I wanted to let you know we do have an outpatient multidisciplinary eating disorder treatment team at our VA. And we do have telehealth appointments available, and we do everything from assessment. So if there's a question about eating-related concerns, right, even if the question is, do I have disordered eating, right, we can certainly talk with you about that. We can meet with you. We also offer individual treatment, group treatment, and referral to outside care as needed. So really appreciate you asking that. You can go through, if you have a current mental health provider, you can talk with them about a referral. You could also ask your primary care provider as well.
Yeah, and it's nothing that like I look up online and it's like, oh, I want to be skinny, or so I throw out my food or something like that. It's purely like I don't feel like I have the normal human urge to eat meals, and I'll just go throughout the whole day, and then it'll be 10 p.m. at night when I'm going to bed. I'm like, I didn't eat anything today, and that's not normal. And I know I can't be the only person that has that, but it's weird.
Absolutely. Well, I appreciate you bringing it up, and also, yeah, I would start either with primary care if you have a mental health provider, bringing it up to them, and we'd be happy to meet with you too and talk with you further about it. We have nutrition services available, all kinds of things. So we'd be happy to talk with you further. Thank you.
Thank you, Marissa. All right, next up we have Jana Efrob Nukusa. Jana, what question do you have for us today?
Hi. Am I up right now?
Yes, welcome.
Okay. Hi, I'm sorry. Yeah, I was kind of listening to that whole egg donor thing or whatever you guys were talking about. Could you explain a little bit more about that?
Yeah, so all veterans are eligible for all veterans that are eligible for primary care are eligible for basic services. So that would be infertility workup to identify if you do have an infertility issue. Also covered is IUI. So that one is included under the regular benefits. Now the higher level of benefits is IVF. So that where you're talking about those egg donors and sperm donors and that is something now that you're eligible for if you want to go purchase your own egg or sperm because you're having difficulties or would need those. And then if you're eligible for IVF, then you could use those and the process of IVF would be covered. However, IVF eligibility is a little bit more strict. And so that's where you have to still be eligible for that first. And then these other opportunities would be available. But the extension for IVF now is if you're eligible due to a service-connected injury that results in infertility, that's how you're eligible for IVF. And it's expanded a little more now for single veterans as well as same-sex veterans and other types of families as well, in addition to married couples in various situations. But the end piece is that the veteran does have to have that service-connected disability rating for infertility, and that's how they would be eligible for that IVF care.
Do you know what that usually is, or?
It really varies by Service Connect, so that's something that has to go through our interdisciplinary facility. So if you want to bring concerns to your primary care provider, then they would look through your service-connected ratings and see is there one that is causing that infertility. So that's kind of another good reason. If you're having symptoms or issues that have occurred that could be related to something Service Connect, make sure you do go and get those checked out because, again, the PACT Act covers so many different things. So that's a good reason to your veteran county service officer so that they can kind of look into that and see if there is some sort of link.
I mean, is there any chance as far as IVF or egg donor that any kind of surrogate could play a part in there or no? So you can't carry or something, so you can't carry the child?
Yeah, so currently we don't cover surrogacy, so that's the one thing that's
okay. Yeah, that is something I wish you guys did have.
Yes, definitely. And there may be more and more discussions about infertility, so stay tuned as we'll announce more things through Facebook or other GovDelivery or our Women's Health newsletter, too. We try to update our veterans on things. All right, well, sorry, I'm getting the time notice. We have about 1 minute left. We'll take one more question. Helen, we have you up with our last question. Helen from Beloit, are you there?
Yes, I am. It's not really a question. I just joined the GeoFit classes, and I really appreciate what that team does. They do a wonderful job, and I just wanted to thank them for, publicly at how great they are.
Helen, this is Sarah Rogers. I'm a social worker and the whole health system coordinator here, and I will just pass your thanks along to the GeroFit team. I hear from a lot of veterans that this is a life-changing program that makes people more confident, increase their balance, their functional strength. So I'll pass along your compliment. And you give me an opportunity to really highlight so many of the wellness and well-being programs we have to offer here at the VA. In addition to GeroFit, there's the MOVE program for veterans who are looking at managing their weight. We have yoga, mindfulness, Tai Chi, eating for whole health, a Move the Body class that's specifically for women. The resources to support thriving are really robust. And if anyone's listening wants to learn more, the calendar is on the Madison VA website under Whole Health. And then you're always welcome to call the main VA number, 608-256-1901. And then the extension is 12537. Once again, if you're interested in more about well-being programs and whole health, 608-256-1901, extension 12537. And I will pass along your warm words, Helen.
All right. Thank you, Sarah and Helen. That's all the time we have for questions today. If we didn't get to your question, please stay on the line because in just a moment you'll have the chance to leave a voicemail with your questions, comments, and feedback. Please know we have recorded all questions and we'll make sure that everyone who raised a question and has not received a response or needs follow-up will receive a response. We plan to get back to you with a response within the next several weeks. Thank you for joining our Teletown Hall. Have a great evening.